Dr. Kelvin Hofarth, BioFit Medicine, Austin, Texas. So, what is functional medicine and how is it different from, say, traditional medicine and other alternative medicines? Are you confused? Well, stay tuned. So, what qualifies me to answer this question? Well, you be the judge. I have been practicing traditional medicine since 2000, and I got my board certification in family medicine in 2003. And for the next 12 plus years, I practiced a complete array of family medicine from obstetrics, pediatrics, gynecology, ICU, hospital medicine, ER, and outpatient medicine, including jail medicine of all things. And in that experience of thousands of patients, I can tell you that traditional medicine has its place for urgent and emergent care settings, and including surgical and hospitalized patients to a degree. Now, the problem was it lacked the teeth to really help heal the foundation of most of my problems, which was chronic care patients. And therefore, I became very disenchanted with how I was managing these patients. And so in 2012, I looked for alternative approaches, which frankly made me feel like I was betraying my traditional medicine colleagues. Because when you go into these worlds, you suddenly are called a quack. Now, I get it. Frankly, I used to say the same thing myself. But then I found functional medicine. Functional medicine is not a new medicine. It's just a new way of philosophically approaching patients with chronic disease. That's an important point, because as a traditional doc, it's so easy for us to discount other traditions of medicine. I can't tell you over the years where some of my patients would be dabbling on the side with, say, Chinese medicine or Ayurvedic medicine or acupuncture, or any other kind of medicine, and I didn't have a clue about these medicine approaches, and they would come back to me, some of them, doing much better. Now, typical traditional design is, it's got to be a placebo effect, it would have worked anyway if they had done nothing, and discount it. But now, as a functionally trained physician who thinks a little bit more strong foundationally from a chronic care perspective, in my opinion, I now can include all the areas of medicine and allow me to appreciate how each one may be useful for that patient depending on where their dysfunction is. So how did we get here? What I mean by that is, how do we get to 2018 design of healthcare system? Now you go back years and years and years, but I'm just going to go back to the 1940s, 1950s, during the time of war. And the military really advanced certain areas of medicine to get our troops back on the field. And that was where the advent of, say, antibiotics occurred. And that was a huge discovery and step forward in our care for patients. Unfortunately, we pushed it almost exclusively in the direction of pharmaceuticals. So now our toolbox as physicians has become increasingly narrowed over the years. Fast forward to 1989. At that time, fortunately, there was a group of about 30 brilliant physicians from across multiple specialties in the world who gathered together in Canada, led by Dr. Jeffrey Bland, to ask one simple question. Rather than us trying to discount each other, what are the core interlinks between all of us? And they utilized all the medical research of that time to discover what those links were. At the end of looking at all the major research studies from all the various traditions, they came up with the 7 core physiological pathways that interlink every one of these disciplines. My patients who work with me know that I always have a tendency to say that nothing is all bad or all good in medicine. Well, the same thing goes for disciplines of medicine. Not one is better than the other. They complement each other depending on where the dysfunction occurs. So now I hope I helped elucidate what the difference between functional medicine is and traditional medicine and all the other medicines under the word alternative medicine. Functional medicine simply is the cement of the philosophy of bridging these disciplines together so that you appreciate how each one helps the other depending on where that individual's dysfunction is. So I ask that if you are dealing with chronic disease, seek out a functional medicine physician, because complex problems require complex solutions. I hope you really enjoyed this video. I hope you will like it, subscribe, as well as comment. And I will be back next week to discuss more areas of functional way of thinking with future topics that I will obtain from your comments. Again, thank you guys so much for watching this week's video. I'm Dr. Kevin Hofarth, Biofit Medicine, Austin, Texas. I'll see you next week.